Welcome back to the Nutrition Connection podcast, the show where science meets storytelling. I'm your host, Dr. Kristen Hicks-Roof, dietitian, researcher, and lifelong advocate of the role of nutrition, health, and wellness. Each episode, I get to sit down with dietitians and nutrition experts, leaders whose work touches nearly every aspect of our lives. So whether you're a student, a seasoned professional, or someone simply curious about food, nutrition, and health, this podcast is just for you. The views, thoughts, and comments on this podcast do not reflect those of my employer, nor the employers of my guests. So let's go ahead and get connected. I'm really excited to bring on a brand new connection of mine. We've met virtually, but we never met in person. So I can't wait to just hear about her story and get you excited about what kind of role she has. And man, does she have credentials. So we're going to talk about those too. So we have Gretchen Zimmermann. She is a spokesperson as well as a cardiometabolic and digital healthcare expert. Welcome to the show, Gretchen.
Thank you so much, Kristen. I'm so happy to be here. Excited for this conversation with you.
It is so funny because sometimes I'm really active on LinkedIn and I comment on people's stuff all the time and I see updates and it's like I know you, but I don't know you.
Yeah, I know exactly how that is. Yes, I'm a frequent poster. I feel that way about a lot of people on Instagram. And then once you meet them in real life, it's like, oh my gosh, we know each other, don't we?
We know. Isn't that so weird how the digital environment, you can build that rapport when you never actually interact with anyone. So I can't wait to really dive through your story and learn all about what you do in your roles today, especially as digital healthcare, because I think that is something that a lot of dietitians are trying to figure out what that might look like. So let's start from the beginning though. What inspired you and made you want to become a nutrition professional?
Yeah, so I've been a registered dietitian for 15 years, but I had another career before I was a registered dietitian. So I worked as a licensed medical esthetician. I lived in New York City at the time, and I worked in a medical spa. I did that for 7 years in my 20s, and it was really fun and enjoyable. I loved the science of skincare. I still do skincare products and all of that fun stuff. But at some point, I had decided I wanted to go back to school and just kind of get a little bit deeper into a different field. And so there were a few things just kind of that converged around that time of my life. Close family member had bariatric surgery. So that kind of piqued my interest. I had started running and got really interested in nutrition, fueling, and kind of the sports nutrition aspect of it, and just really found myself leaning into nutrition programs and looking into dietetics programs. And that just felt like the right next step for me. So that was about 15 years ago. And I've worked in various settings, which I know we'll talk about in just a second here. But yeah, it's been a really maybe a different path. I know several dietitians who this is their second career and did some really interesting things before. So.
Yeah, when I was a faculty member at University of North Florida, I can't tell you the amount. Mostly taught in the graduate program, so the master's and doctoral program. I would probably say 50% were second career. And they had a very successful previous career, whether it was marketing or beauty or, science or whatever it was. But they had kind of this calling to them of health was important to them. Maybe that was physical activity. Maybe that was metabolic health. Maybe that was chronic disease, whatever it was kind of, you're right, this convergence, maybe this is the direction I need to go. And I'm sure you still use some of your skills and techniques and knowledge that you had from your previous career to be able to leverage into what you do today.
Absolutely. I would say that was kind of my first exposure to looking at the literature and the scientific literature, and understanding what skincare products are efficacious and ingredients. And, that was probably the biggest intersection between this, the skincare and the beauty world and nutrition. So there's a lot of similarities there.
I love that. So my brother, he's actually a dermatologist, and we battle all the time because he does not believe nutrition is a huge part of skincare. And not that he doesn't believe it, but he believes that there's other opportunities and other products out there. And I'm like, yeah, but it all starts with the foundation of nutrition.
It
Like I
does.
remember when he was gonna, become a PA and he took a nutrition class, he's like, dude, can you help me with this assignment? And I was like, no, this is like the most critical thing. You need to learn nutrition
Yeah.
as part of your
Yeah.
role.
Yeah, it's a big piece of the puzzle, I would say.
For sure. So
Yeah.
let's talk about your journey. You ultimately decided that you wanted to pursue being a dietitian. What kind of roles have you had to where you are today, just really as this expert on cardiometabolic and healthcare technologies?
Yeah, so initially I went into the inpatient setting. I think we all hear as registered dietitians, you got to get that clinical experience under your belt. I had always been interested in leadership and management. I'd held those types of roles previously, but I really wanted to get that clinical experience. So I worked inpatient in a hospital in San Francisco for a few years, and then I worked in an outpatient clinic in bariatrics and weight management. I worked with an endocrinologist and had an opportunity to establish a weight management clinic with her. And this was so funny because this was probably 12, 13 years ago. And I remember counseling patients on weight management, and we were prescribing Saxenda at the time. So that was like one of the earlier GLP-1 medications that was used for diabetes, but they were also seeing weight loss results. So kind of crazy how that, when I look back at that time.
Full circle.
Full circle. Yeah. So always just found myself in the weight management space. I did not love working in the inpatient setting for whatever reason. Every time my pager went off, it just brought me great anxiety. It was like a lot of pressure. I know that dietitians can probably relate to this. There are some who just absolutely thrive, right, in the ICU and in those settings. But for me, I kind of knew that there was something else for me. I also found it hard to educate patients, like a new diabetes diagnosis, for example, in that setting, because patients aren't in a place to retain that type of information, right? And it was always very hard for me to see them go and not see them again and not follow their success. So I then kind of sought out a different opportunity where I could do that, right? Where I could really follow the patients on their journey. I found a company that I spent 12 years of my career there. I just left a few months ago. But this company was one of the first telehealth companies, started in 2014, where we were treating patients for weight management and health coaching. So I was a health coach at that time, even though I was a registered dietitian. And that was awesome. That was exactly what I wanted. It allowed me to build those longitudinal relationships with patients. But I really grew in that company and moved into different leadership roles, led the development of the clinical org, had dietitians reporting into me at one point, a lot of dietitians. You want to talk about nerve-wracking, having, monthly meetings with a whole room of very smart dietitians. But yeah, just like a lot of really great opportunities in the digital healthcare space. And so specifically, I specialized in cardiometabolic health, this company that I worked for, diabetes, and then eventually obesity, the GLP-1s as they came to the market about 2.5 years ago for obesity, and played a role in building out our clinical programs, evidence-based protocols, worked with a multidisciplinary care team, and eventually found myself moving over to the commercial side of the organization, just kind of taking on different roles over there. So I will just stop for a second there because that was a lot, but I think that's, probably the best summary I can give of what the last decade or so has looked like.
I mean, really, you were kind of at the cutting edge before it was cutting edge. You know what I mean? Like, it reminds me back in my academic days, my goal in my research era was to develop a virtual interprofessional clinic. And it all happened before COVID. And then like COVID hit and I was like, see, like this virtual interprofessional clinic, and it was all digital. And you can have a social worker and a dietitian and a physician and a pharmacist all talk to each other with the patient at the same time. Like, how cool is that with telehealth technologies?
Awesome.
And I feel like we're still on the emerging side of telehealth, especially when you think about all these digital tools. that can provide us data. So it's cool how like every experience that you had almost laddered up to what
Yeah.
you ended up doing.
Yeah, absolutely. And you're right. It really blew up during COVID because people needed to access healthcare, right? And that was the best way to do it. And thankfully, I was in that role. I know a lot of businesses obviously suffered during that time, but if you were in the telehealth space, man, were you busy? It was just rapidly scaling, your providers and the care that you could deliver to really meet that need. So that was obviously an unfortunate time, but like a very exciting time in terms of just growth.
So I'm curious. I mean, I have run small teams of dietitians, but like, what was that like kind of stepping into a role and managing a lot of dietitians who come from, yes, we all have the same training, but we also have a whole different lens, right, of each way that
Yeah.
we provide and counsel and educate. So what was that like? Maybe for those who are listening who want to go into that role of like, I want
Yeah.
to be a people manager of large dietitian teams or nutrition teams.
Yeah. So, I mean, overall, it was an amazing experience. I still have very good friends to this day who are dietitians. Overall, the dietitians that I worked with were the most supportive group of professionals that I've worked with. It was really interesting because at that time in this organization, I was leading a team of health coaches who were dietitians but weren't able to practice M&T yet. And so part of the initiatives that I led was to, with my team, get 50 state licensure so that all of our dietitians could provide medical nutrition therapy across all 50 states. And so that in and of itself was a challenging process.
Yeah.
I had to really, to say the least. I mean, what the laws and the rules and how they vary state to state. And so I had some really fantastic dietitian leaders who I was working with at that time who really supported me and helped us to get to that place. But I mean, to your question, it was intimidating. At one point, we had several hundred dietitians, and so of course your imposter syndrome kicks in, right, when you're in that kind of role and that big of a role for the first time, and you think like, oh my gosh, I'm they're gonna pick up on something that I might say wrong or inaccurate, but like none of that was true ultimately. It's like we are our own worst enemies sometimes, right? And ultimately, like I said, they just ended up being some of the most supportive people I've worked with, really smart people, different areas of specialty, all just kind of bringing their own secret sauce. We all shared this really unique passion too for being in the telehealth setting, like you said earlier, and like the cutting edge and like just this excitement about being able to deliver care in a new way and to be one of the first companies that was delivering medical nutrition therapy. So, I mean, overall, it was an incredible experience. I probably worked the hardest I ever have in my life during those years, for sure, though. It was not easy.
Well, and I think that is almost like where we're at today in society with GLP-1 usage just,
Hmm.
skyrocketing. And although it's not mandated right now that you need nutrition or dietitian consults, I think that's where you're going to start to see separation with some of these platforms, right? These telehealth platforms of, yeah, you can just do medication by themselves or label it with a commercial, any sort of commercial company. And now all of a sudden you have better outcomes or
Hmm.
better maintenance, less attrition. I mean,
Yep.
there's so many layers to that. So I think the future of dietitians is only going to grow, and grow in terms of like expanding where we're at, but then also the capabilities that we can provide from every level of the
Yep.
chain, right? So let's talk
Yes.
about what do you do, kind of like what is your day to day or your current role as a spokesperson, and then in your role you're at today, what does a day to day look like?
Yeah, so I am a newly appointed spokesperson for the Academy of Nutrition and Dietetics. I am super excited about that. It's been something that I've been focused on for a few years, just in terms of like building up media presence and getting media training and trying to get in different types of media outlets, print. Haven't done any broadcast yet, but just really building that and building those skills. I've done a lot of thought leadership and speaking at conferences and public speaking, which, by the way, if you're scared to death of public speaking, there is hope. um, because that was me early on, but now I absolutely love it and can't get enough of it. And so, yeah, I just found I was really passionate about the media aspect of being a dietitian and really had focused on that the last few years. So very excited to work with the Academy and really represent dietitians, especially in those areas of my expertise: obesity, GLP-1, policy, right? All the really important areas. But then I still work in digital healthcare and cardiometabolic. I work for a company that is using AI to enable healthcare. And so that's a new conversation for me. I'm still learning a lot about what that looks like and what ethical and safe and secure AI looks like, and how do we deploy that in a way that's responsible, not taking the job of our clinicians fully. And, of course, none of us want that. And so, yeah, so that's what I'm doing right now. In my role, I work with different like consultants and brokers, just kind of educating on this product and this company that I work for. So a pivot for me, but I'm loving it. It's been really exciting. And it's like, again, kind of cutting edge, being at the forefront of this new thing, which is AI. Very polarizing.
One of the things that I love too is you can pivot as nutrition professionals.
Yes.
I know we've talked about it, like we're trained to do so many different things, and you can jump from one sector to the other because every job that you have gives you the skill sets to be able to pivot. So I think that's really cool. I was actually just talking with my chiropractor the other day because he does dictation. And that's how he kind of writes his notes. And he's like, the amount of time that I have saved in typing out notes. Now there's a whole personnel that needs to make sure that that's accurate, right? For HIPAA and also for medical reasons. Otherwise you're going to get sued if the note is wrong, right? Like amputate left leg. No, it was actually right leg. I messed up the dictation, right? So I do think
kind of a big deal.
But when it comes to medical and legal, there are a lot of complications. So I think some of these AI technologies, like I understand why people have fears that it would take a job, but I would say, how does it make you more efficient? So that way we can get back to the thing that we're really good at, which is patient facing, right?
Yes.
It's really helping the patient and spending time with the patient and using these tools and technologies to make that process more efficient. So you're not there, typing your assessment notes at 6 p.m. or later, right? Mm-hmm. So I think there's a lot of opportunity for that, as well as many other health technologies. I've had other people on the show already in health tech, and I think it's an exciting space to be, especially in the GLP-1 era, where you can get them on your phone. You can order it on your phone, basically, and they'll ship it to your house. So pretty wild, isn't it?
It is. Yeah. I mean, and that's how I think about it too with AI. And that's how physicians are using it too. And other healthcare professionals is they're pulling off those low risk administrative burdens that like to your point, chart notes and even reviewing medical charts and using AI to be able to kind of like, review and pull out the pertinent details and provide a summary. And so I think that's some of the low hanging fruit. And I think, we're going to see it evolve pretty quickly over the next 6 months to, 2 years.
Yeah. Well, I think once you start to integrate AI into large data collection, like mm-hmm. the Oura rings or the glucose monitors or whatever, now all of a sudden you can, I got a ultrasound the other day, and they were like, do you want the AI add-on? It was like $20 extra. And basically they were saying like this AI add-on can detect a cancer 3 months before the human eye. And it's like, you think about those technologies and no, it's not replacing a job, but it's in supplement of mm-hmm. the job. And yes, there will be some replacement, don't get me wrong. but you'll have more efficiency. So I'm
Yeah.
super fascinated in this because, like I told you, I wanted to build a virtual interprofessional clinic model. Like that was my research for almost 10 years. And
Yeah.
I felt like, but then I left academia, and then basically it just went down the drain because no one takes over your projects when you leave academia. So
Yes, I've heard that. That's
it,
unfortunate.
it is unfortunate because there's so many
Yeah.
cool things. But I also like that you're a spokesperson because, we need more people out there who are science communicators and being able to go through the noise with your expertise and say, hey, here's actually what the data is saying. And
Right.
having that visibility. So I'm excited for your journey as spokesperson. I
Thank
know
you.
I have a lot of friends who've gone through that program. At one point, I want to go through the program, but you have to be
Yes.
careful depending who you work for. So I think
That
it's a
is
great
true. Yeah.
opportunity to get media and just elevate dietitians' voice. So I'm
Hmm.
excited you're doing
Yeah, me too. Thank you.
it. So let's talk about scientific evidence and data. How does that play a role in what you do in your day to day, whether either one of your roles?
Yeah, I mean, I think probably the best example is, again, the GLP-1s and the indications that are, seemingly coming out and approved almost by the day, right? I think the latest one I saw a study in the potentially a reduced risk of breast cancer, right, with GLP-1s, which is really interesting. So that's really relevant to the work that I do, and especially the work I was doing at my previous company. When you think about building these clinical programs, and you have to evolve as the market evolves and as the scientific community evolves and as these new guidelines come out. I work a lot with the employers and the employer and the benefits ecosystem. And people are just so savvy now. A lot of these buyers and the HR leaders, they're savvy, and they hear all about this and they hear about the research and the new indications. And so they ask a lot of questions. And so, for me, it's been critical to really stay on top of the research and these findings as they come out by the day on GLP-1s. Fascinating. It's promising. But yeah, that's been uh, probably that's probably the best example I can give right now, the most relevant.
Well, and you're right in the
Yeah.
sense the scientific data that's coming out, I mean, it's literally every day. Like I was just on
Hmm.
the Retrodied, I don't know how to pronounce
Yeah,
it.
retatrutide, I believe.
Okay, so you may not know either. It is the data coming from that
Yeah,
is
it's
incredible.
amazing.
I mean, it's actually
Hmm.
terrifying a little bit, but it's also
Hmm.
incredible when you think about not only weight, which I think is a huge part, especially if you have a country that's overweight, but then there's so many more uses. Like you said, you're starting to see reductions in other comorbidities. So how do we use some of these
Yes.
medications along with technologies to really elevate the space? So I think it's just a really
Yes,
exciting time. And you're
it
you're at the
is.
cutting edge right now.
Hmm. Yeah, absolutely. And it's like what we're seeing too in the research is that when people go off of these medications, which by the way, they need to be lifelong medications for some people, that's just the reality. But what they're finding in these clinical trials, and you know this as well, is that when they come off of these medications, those biometrics like blood pressure, cholesterol that improved while on the medication will go back to baseline, right? So we know there's that really powerful effect there. And then there's some other research that shows that those improvements may even not be related directly to the weight loss, but by the mechanism of the drug. So it's fascinating to me, and it's like it's quickly evolving and just really kind of awesome to stay on top of all of it. So yeah.
When one of the things that stood out to me in your credentials is really your involvement in your credentials around lifestyle medicine. So how do you see that kind of interplay with what you do in your role on the clinical
Mhm.
side with lifestyle medicine?
Yeah, so great question. I don't know if you remember, but there were some guidelines that were put out for patients on GLP-1s probably about a year ago. It was the Obesity Society, it was the American College of Lifestyle Medicine, right? And it was what's the third one?
The
the
academy.
uh, the the academy. Thank you. Yes, I should know that. So it was the academy, and and so they came out with these guidelines. And if you look at those guidelines and the interventions that surround GLP-1s, it's all it's lifestyle. And this is nothing new, right? Like we all know this. It's nothing groundbreaking.
Yes, I do know.
Right. But the fact of the matter is that you can't do GLP-1s without these lifestyle modifications. You want to call them lifestyle medicine. It hasn't been fully accepted by the whole medical community, but it is, right? It's sleep, it's stress management, it's nutrition, obviously, it's exercise, it's mental health, it's managing depression and anxiety. And so, when I think about lifestyle medicine and the best way that I think about applying it, it's in that context for any patient who's on a GLP-1. They should be receiving or engaging in those type of behavior changes. And I'm sure that they are. We know our patients are doing these things, right, already, many of them. But yeah.
Yeah, I think it's funny sometimes because when you look at literature, in a way it's so controlled that it's like, what does the practical life look like, right? Like, how are people able to do it? If you're working 2 or 3 jobs and you got kids and you're driving to soccer practice and gymnastics and ballet and all these other things, it's like, how does lifestyle medicine fit? Because, as dietitians, we're also trained on sleep, mental health, physical activity, nutrition, because that's all the layers of health. So I think that there is some, again, I feel like I'm going to preach this until I die, is there is more opportunity for dietitians to be at the table.
Yes.
And I love that we can be there in every aspect of lifestyle medicine. Not that we're the only ones, but we should have a seat at the table. So you've had
100%.
You've had a really successful career, and you've had a lot of kind of different pivots as you've gone through your career, all the way back from being an esthetician. So what's been your favorite so far? What have you just loved doing?
I mean, just to say, that's the reason I love this field. And for anyone who's considering getting into the field, it's like you really can make it your own thing. I think that we tend to draw in a lot of entrepreneurs, right? And people who want to run their own private practice or who just have that business mindset. And so I think that's really amazing, right? And when I talk to a lot of dietitians, I find that that's like kind of a common thread. So, I mean, my favorite pivot, honestly, was really that move into telehealth, into digital healthcare. I particularly loved doing the clinical program building diabetes programs and the obesity program, and getting into all the evidence-based guidelines. See, this is why I need to go back to school for my PhD.
Hey, I'll support you if you want. I mean, you got all the knowledge to do it, but I think you're good.
Just kidding. But I love that stuff. And that makes me happy. It makes me feel like I'm contributing in a meaningful way to our profession, to the bigger community, to the people who are, responsible for providing this care. So yeah, I think that's the piece. And I don't know, I'm really excited for what's next. It's a new chapter for me.
That's for sure. And, things are changing so fast too in today's environment, whether it's, technologies or just like how we're practicing or what's covered in practice, especially with things happening in external of our environment. There's a lot more interest in nutrition in general. Like I'm getting random people, like my physical therapist is asking me about nutrition, which they should, but they don't typically.
Yeah.
So it's kind of nice. Like now you're actually like having movement, like people are thinking about nutrition, not only with their dollars, but they're thinking about it just in their day-to-day life. And so that to me is just like super exciting, and it drives me. I mean, yes, I have a PhD, but I would say, I don't know if I went for the right reasons. I loved college, and I went to 10 years of college. That in itself was like a joyful time for me.
Yes.
What would you say, Gretchen, is some like suggestions or tips would you have for someone who maybe wants to go into that telehealth roles or health technologies or even being a spokesperson? Like, how did you prep yourself to be able to apply? Because that's a very competitive process as well.
It is, yeah. I mean, I would just say, and this might sound cliche and you've heard it before, but like one of the rules I followed early on in my career was just say yes, to just say yes to all the opportunities. Like I think as dietitians, that's what we do, right? It's like our innate
Yes.
um, behavior is right. But it got me a lot of opportunities, right? That maybe I wouldn't have otherwise gotten. One thing leads to another. And, I just feel like that's kind of how it works. I think the other thing that's really important is building your network. I've always been very focused on people and relationships. Relationships are really important to me across business, and maintaining those and making them personal where you can. I think, that really helps you too in many ways in the long run. Um, One of the reasons I went back for my master's in business was because they talk a lot about it being a really great network, depending on the school that you can get into, and so that was like a big draw for me. So and that's not for everybody, I realize, but it's a good move if you want to get into leadership, especially in the telehealth space in these Silicon Valley companies. I feel like it's kind of table stakes at this point.
But yeah.
So yeah, those are yeah. So those are just some, I guess, some initial thoughts. But as far as the academy, that spokesperson role, I just had really focused on building my media presence. Again, saying yes if someone reaches out to me and they want me to write something or contribute. If I don't have the time, I'm still going to say yes. I'm going to make it work.
The same disease, Gretchen. How do we get rid of the disease?
And then you're stressed out sometimes and you're overwhelmed. But at the end of the day, it feels so good when you hit send.
I feel this deep into my core. And I tell my husband every year in January, I'm like, Daniel, I'm going to say no more. And he's like, yeah,
Right.
nice try. Because as soon as I start saying no, I'm like, someone has this shiny ball in front of me. I'm like, okay, I'm
Exactly.
going to say yes. I have to say yes.
I think that's called boundaries. I've heard it called boundaries, but it's hard.
Oh my God. I do think it's funny you say those things though, because I feel like if we did an AI transcript of all the guests I've had, right? So in over 50 episodes, I would say 85% of them have the exact same feedback. Say yes, build your network. And that's nothing against what you're saying. I think it's really showing like, hey, there's this common theme. And that's not out of sheer luck. That's out of, hey, I've been through these roles. I've taken responsibilities. I've pivoted in my career. And it all led to these two core constructs, which is building your network to be able to get you to get another role. Maybe that's a friend who knows who's hiring, and say yes to something you never even thought you could do. Like when I came into the role that I'm in today, I didn't really know anything in regulatory. Like I just had to learn. Right. And you're just going to be like, yeah, I can do that. I mean, I have the skills to do it. I don't know how to do it, but I will find out how to do it. And so I think a lot of dietitians have that like, yes, mindset and like finding solutions to things that maybe there was no direct path. So I just think that's super cool.
Completely agree. Natural entrepreneurs, like I said.
It is. And oh man, there's so many people that, yeah, you see it across many different people that I know, whether that entrepreneur is within a business or within a private practice or in the media, right? We kind of always have this little edge of,
mindset.
I want more.
Yes,
yeah.
100%.
So if you had, this is my favorite question. I love it. And AI actually helped me generate this question. And I'm like, AI, you're genius. Like if you had a crystal ball, think of like, what could happen? What do you think is coming next in nutrition?
Well, of course, I'm going to say AI because that's what I believe.
It's true.
Because that is what I believe is next. And I've been really thinking about this lately, though. Honestly, I've been thinking a lot about this. And I know that this is polarizing for people still, right? And for various reasons and good reasons. But it is inevitable, right? It's here. It's going to happen. And so it's like with GLP-1s, what side of it do you want to be on, right? Do you want to be on the side where, people are going to take these drugs regardless? So let's get in there and support them as dietitians. Yes, I want to be on that side. And I also want to be the side of, are we building, clinically, ethically responsible models where AI can exist, assist, but in ways that we can audit them the way that we would a human care team, and monitor them and make sure PHI and everything is HIPAA compliant. And so I see that across all different types of workflows in dietetics and in different types, other physicians, right? They're already using it. And so, I think it's just a question of where and what is it going to replace. Um, I think it's good in a lot of different ways in the dietitian's workflow. We all, let's be honest, we don't like making meal plans. I don't know a dietitian that likes making a meal plan. I've never met one. Have you?
No, I haven't, but I will say a lot of dietitians use that as a side gig, right? So I do think it will
That's true.
quote unquote, take some roles, but it'll also make you more efficient to do other things that you actually do enjoy doing, which are not meal plans.
That's right. And I'm not saying that ChatGPT should create meal plans. I'm not saying that. But I'm saying that it can be a supplemental resource, right? If someone has like specific cultural considerations or food allergies or food sensitivities, and they need ideas for different foods that they can eat. It's a lot of work for dietitians to do that. So that's potentially one area. But anyway, I could talk about this for longer than what we have allotted here, so I'm going to stop there.
I think that AI, you're right. I mean, there's been a couple people with crystal balls, but I think you come at a different angle of how do we use AI in a very monitored way, right? Of like, how are we making sure that it is accurate, it's compliant, it can align or mimic a healthcare team when they're doing intervention. So I think there's a lot of opportunity for AI to grow in that way. And I think it's a call to action for dietitians and nutrition experts. Like, how are you leaning in? What does that look like? Are you using AI in your workspace? Or if you're trying to get into new roles, let's say it's food manufacturing, or I don't even know what you'd go into, right? How, I feel like if I was hiring someone, I would want to know what their capabilities are related to AI now, right? Like, and if they come to me and they're like, no, I don't use it, I'd be like, all right, like to me, that is almost, you're not leaning in, you're pushing away. It's been here long enough that you could have leaned in.
Yeah.
So, yeah, absolutely. Well, awesome conversation, Gretchen. It was great to get to know you and tell your story. And if you like the podcast, make sure you like, subscribe, leave a review. But most importantly, check out the next episode, because every episode I bring on a different dietitian and nutrition expert to share their story and give you tips and advice on how to be successful.